Greetings and welcome to the SUKI Podcast. My name is Iddi Mtumweni and I'm thrilled to have you join us for this special episode today. If you enjoy this discussion, please feel free to share this link with others who may benefit. At SUKI Podcast, we provide a platform for individuals from around the world to share their journeys, stories of success, challenges, and resilience, because we believe these experiences have the power to inspire and encourage us all. Join me today is a very special guest whose story I'm certain will inspire you in one way or another. Professor, it's an honor to have you here today. Could you please introduce yourself to our listeners and viewers?
Thank you, Iddi, and thanks for having me here. Well, I'm Blaise Dondji by birth, a professor of biology. My background is immunology and infectious disease. And I was born in a very rural village called Bawa in Cameroon. And I moved to the US in 2002, working at the Yale School of Medicine, developing vaccine. And in 2008, I moved to Washington State to start a professor job at Central Washington University. And more importantly, as I mentioned to you, I'm from Bawa, meaning that as I travel around the world, I call myself an ambassador of my village. So maybe I'm sure we have the chance to talk more about Bawa and the rest, but this is who I am. And I'm a dad, meaning that I'm married, I have 3 kids. Thank you.
Thank you so much, Professor Blaise. As you mentioned there, you come from Bawa village, and I know that you co-found this initiative called Bawa Health Initiative. My listener and viewer would like to know, why did you establish it, and what the story behind it?
Yes, it's a very unfortunate story, but that's what led me to where I am today with that nonprofit. So, as I mentioned to you, I'm from Bawa, very rural village in Cameroon, where as a child I went to elementary school, going around without shoes, going around with clothes that have openings everywhere, and not having clean drinking water, no electricity, and the rest. So, but growing up, that was a challenge for me and my brothers and sisters. But what actually really struck me is that at the age of 12, my mom was pregnant with my sister, and she delivered my sister, and she bled to death in my village. Because at the time, there was not even a bicycle in Bawa, talk less of a motorcycle to take her to the nearest health center that was about 13 miles away on dirt road. So, and when I went through that, I felt that my mom, for sure, we are not going to stop anybody from dying, but my mom did not have any care. No nurse was by her side. No doctor was by her side. She had no medication. She had no care. And that really concerned me. I said, why did that happen to my mom? But the good news that I got from that is that I told myself, if God gave me the means, no woman in Bawa would live through what my mom lived through. No lady would die in Bawa without care. So, and that's how I came up with the idea of starting a nonprofit one day, which I started with a good friend of mine in 2005, Professor Dondji. So we started the nonprofit organization Bawa Health Initiative to provide healthcare to people in Bawa and surrounding villages, and also develop control program to prevent diseases, educate people. So we've been doing a lot, which again, we can go through after you ask some questions, but let me know.
Thank you so much. That's very sad and difficult story to hear. But I believe from what happened in our life, whatever action that is happening, whatever situation that we're in, if we can sit down and think, we'll be able to establish something amazing that will prevent the other situation like this to happen. And
Yes.
and thank you so much. You did that because you saw what happened to uh, the family, what happened to your family, and you wanted to prevent it. I
Yeah.
recently come across an interview you did like 11 years ago. You were asked about your vision for the Bawa Initiative over the next 5 years at that time. And you mentioned establishing full functional clinic and securing ambulance for each operation. I'm curious, how did you manage to achieve these goals?
It is, I cannot say I've achieved those goals because, this project is not about me. So it's about people in Bawa and surrounding villages. So what I always tell my wife, who has been helping with this project, is that we are working for God. If He doesn't provide, this is business. We are working for Him, so He should do it. So yeah, so and He has been there. So building the clinic, equipping the clinic, collecting equipment here in the US and shipping to Bawa, putting all the machine, the ultrasound, the solar panel has been God work. So I cannot tell you that I have achieved it. God has made it happen. And the ambulance was just another amazing project that I embarked on. Everything has been amazing, I can tell you that. And what I've realized, I'll tell you, is that, and anybody listening to us, is that just think about it. If you think about something good, God will help you get it done. If you want to help others, if you look at yourself as a tool to make other people's life better, God is going to open the doors. So in sometime early 2019, the clinic opened in 2017, and I had a team of physicians and nurses from Washington and Connecticut who launched the clinic for me in 2017, actually December 4, 2017. And that was the most beautiful day of my life. I can tell you that when the clinic opened. But back to the ambulance. So 2019, early 2019, I got a message from the staff at the clinic that a lady in labor came to the clinic with a breech baby, meaning that in this case, the leg was sticking out. Our clinic doesn't have an operation room. We cannot carry surgery. They cannot do C-section. At the time, we had managed to get them a motorcycle. So they put that poor lady on a motorcycle for 13 miles on a dirt road to the a major hospital, which was in Chan, the city that is closer to Bawa. Luckily for us, God made it happen. She was able to get C-section, and the OBGYN at the hospital there happened to be my friend and classmate from high school. He did the C-section, saved the baby and the mom. But when I got that news, I told myself, if this lady had passed away like my mom, I would never forgive myself. I put this clinic there to make sure that it doesn't happen. It was going to happen. What have I been doing? And I told myself, we must have an ambulance. And I contacted my nephew who is in France to check on ambulances quotes in Europe, because the ambulance in America might not do very well in Cameroon. So he got me a quote, and I collected a quote which was about $60,000. And I collected the quote, and I sat down and I prayed over it, and I thought about one of my good friends who has been a donor for the nonprofit, and I sent a text. I said, I want to meet with you. He said, okay, let's meet at 4 at my club. So I met with him at the club. He said, what's going on? Why do you want to meet me urgently? I said, look, God has made it. It's a miracle that this woman who went to the hospital in Chan didn't die. So I don't want that to happen again. I need an ambulance for the clinic, and I need help. And my friend said, do you have a quote? I said, I do. I gave him the quote. He quickly converted euros to dollars and told me, oh, this is about $60,000. I said, yes. He looked at me and said, Blaise, you've been working on this project. I'm going to write a check for $30,000 for you, and you go and work hard and get the other 30. Oh, Iddi, what else do you want? Yes, that's the first person I spoke to about funding the ambulance. And he told me that, and I felt like flying from the place we met to my house to tell my wife that this was what has happened. And when he did that, I contacted my parish priest at St. Andrew Catholic Church here in Ellensburg, and I told him about the project, and I asked him to give me the permission to talk to people after Mass and to see whether they can help me raise the fund. So he said, okay, come over. So that weekend, I attended the 5 p.m. Mass on Saturday, 3 Masses on Sunday. And I had a video of the road of Bawa to the clinic and had a motorcycle, and I showed that to the people. And guess what, Iddi? That weekend we raised $16,000, $16,000. So we were very close to our $60,000. So, and people wrote checks, $2,000 immediately right there at church. So that's how we got there. After that, people continue to check. Do you have enough? We say no, they will write more checks. Do you have enough? And then we started doing more campaign, talking to people. And so I started going to people again, begging for them to help. And they did. And so we were able to raise about $70,000 to get the ambulance to Cameroon and to Bawa. And it got there in 2020, February 2020, if I can remember exactly. And yes, it has been saving lives. It has been saving lives. And guess what? When I was in Cameroon this summer, I met the baby and the mom who were, the mom who was in labor that 2019 with the breech baby. I met them the first time because I never asked the question who was, because it was scary to me to ask. I didn't even ask, how did they make it to the hospital? I couldn't. So I met her. Surprisingly, a coincidence. I met her and her baby and her husband, and they told me the story how they got to the hospital. Yes, so it was amazing. Yeah,
That's amazing story, and like you share there, when you have a good hope and you have like good vision for the people, other people will see and will support that.
yes.
Like what they did on charge, immediately they wrote a check for you because they see the need for that to happen. So looking ahead, my question is today, what is your vision for the Bawa initiative on the next 5 to 10 years?
You want me to say I'm not going to go there, you want me to reach, and you come back and ask me, did you get there?
Yeah, I will definitely be back in 10 years, and we're going to discuss what is the achievement that you had.
Yes, so the hope is that because of my mom and my sister, this clinic, I'm hoping that is going to be a specialized size for OBGYN and pediatrics one day. Right now, we have specialists like we had a nephrologist last July who came and saw patients there. Before that, we had OBGYN, pediatric neurologists, and so on, who have come there to see patients. But I'm hoping that in the future, because we have a big piece of land where we can build a bigger clinic and bring more equipment to the site. So I'm hoping that in the next 5 to 10 years, we should be able to build and equip and hire pediatricians in all different specialties of pediatrics and even OBGYN to take care of women and children. But it doesn't mean that the men and other people are not included, but that's going to my focus. So that's what I'm hoping. But right now, I can tell you that I'm very proud of where we are, because even though I told you we didn't have power in Bawa when we started the clinic, when I was going up, but we have solar panels at the clinic that provide power throughout the year. It was funded by the Rotary Club here in town, in Ellensburg. So we have solar panels that supply enough power to take care of computers, ultrasound machine, refrigerators, microscope, all the equipment that we have at the clinic. And guess what? Something that we didn't plan.
That's right. That's
It's the
right.
cell phone charging station now. People come there to charge their phone. Right? Yes, because that's the only place where you are sure there's power in the whole area. People come there, they walk for 2 hours, walking for 2 hours to come and charge their phone there. We didn't think about that, but that's something it's doing. So yeah, that's something we didn't have in mind, but which is serving the village. Beside that, children come there in the evening to study, to read their note because there's light. So they come and sit around the clinic to study. So and they also come there to watch soccer games. When there's a major soccer game that Cameroon is playing, the whole area, people come from all over to just sit down and watch the games, which is and a plus to what we thought we were doing. So we didn't think about that, but it's great that people are using that for other things that we didn't plan. Yeah.
Yeah, you giving people hope in every daily activity of life. In some point,
Yes.
you didn't even think about that, like the telephone charge, the watching football, and
Yeah.
everything. Indeed, that is
Yeah.
very inspiring and very powerful.
You mentioned hope a few minutes ago. That hope that you give to people, you cannot buy that with money. That you cannot buy that with money. And even the people just sitting in the village, knowing that if they get sick, they can walk to the clinic, just knowing that, that psychological comfort. You don't buy that. I remember when I went to Bawa 2 summers ago, one mama there, she's much older than my mom, who passed away when I was just 12. She told me, I don't have any problem in the village. I said, why? I said, if I get sick, my hospital is just a couple of minutes walk from where I live. So I said, how are you? She said, I have no problem. Just knowing that if she gets sick, she go to the clinic and having that psychological comfort, you don't buy that with money. So I'm just very grateful to God to make that happen. And again, he's using me. He could have used any other person. So, but again, I'm happy to be that channel that he's using to bring hope to these people. And not just me, but all the people, including you now. You are joining the bus, the Bawa Health Initiative bus now, Iddi. You're on the bus now. So you are now involved, right? So everybody that he has used to bring hope to these people, I'm very grateful to God for that. Yeah.
Exactly. And you're not just touching the people of Bowers, you're touching the people all around the world. I mean, Professor, whoever come across with your story, you will inspire them in one way or another, like I shared that before. My dear viewers and listeners, this is the SUKI Podcast. I'm Iddi Mtumweni here with Professor Blaise. Thank you for staying with us. Please share your thoughts in the comment and let us know what do you think about Bawa Health Initiative. And we're going to attach the link on this conversation so you'll be able to donate anything that you'll be able to do it. Please donate to support Professor on this amazing initiative. Now, let's talk a little bit about your recently event at Issaquah, which was truly marvelous. The music, the food, and the auction were all exceptional. How successful was the event, and did it meet your expectation?
Yeah, it was very successful, and I have to acknowledge my brother-in-law, Dr. Patrick Ngachu, who organized the event. It was the first time we were doing a fundraiser in the Seattle area. We always do it around Ellensburg, but he decided to do it over there, and he was for the first one. You saw that yourself. It was very successful, and he met his goal, and hopefully he'll go back and take the buy much higher. So, but I was very impressed. The attendance, the food, everything, the camaraderie. And that was a great opportunity for me to meet you and other people. So, yeah, it was very good. I'm hoping that we'll go back for another one. Yeah, I told him.
Soon.
Because I'm always asking for more. If you give me $10, I'll come and ask for 11.
That's right. That's right. That's right.
$10.15, Yeah.
That's right. And my dear viewers and listeners, you will find the highlights clip of that event on this channel here. Please go and look how amazing the event was. Okay, now you inspire a lot of people around the world. And the reason we invite you in our podcast today is so as we can share the story and people they can hear the story as many as we can. Do you have any plan to expand this project, not just in the Bawa area, maybe in a neighborhood village? We're talking about like neighboring country like Nigeria, Chad, Central African Republic.
And before I get to that, I can mention a little bit about the donation we talk about. Actually, we've had donation all the way to Japan. So we've received donation from Japan. Yes, so somebody read our story and sent a donation from Japan. So all over the world, as you said. Yes, we have, beside the clinic is our most expensive project. But we have other projects such as the bed net that we distribute to prevent malaria. We have the water filters so that when people go to the stream and collect muddy water, they put through a filter to get clean water to drink. And especially the water filter project has been copied by a non-profit in Benin Republic. So many years ago, I have to go through my document to see when there was a water day event, a World Water Day some years back, and we appear on that. We had a journalist who came to Bawa and showed that, and so from there, people were able to see the Bawa water filter project and took that to Benin Republic, and I don't remember other countries, but I haven't done that myself, but people have seen that and copied that and modified it to the way that will be adapted to their own situation. So yes, definitely. If somebody wants to tap into what we've done, we are happy to share anything, even the project from the start to where we are today. And so before I finish, one thing that I'll mention to anybody who wants to start a project is a lesson that I learned in 2005 in New Haven, Connecticut, when I started this project. I was fortunate to meet a professor, I'm forgetting his name, a professor from Harvard Medical School who started a project in Haiti. He told me, Blaise, when you start such a project, people ask me, how are you going to pay the nurses? How are you going to build the clinic? How are you going to keep it? If you listen to that, you'll be overwhelmed. You are going to stop. If you believe in it, just keep going step by step, step by step, step by step. So I would advise anybody who is starting any project, any humanitarian project, to not think too far ahead. Do what you can do today, tomorrow will take care of itself. And that has happened to my project. When I started, I was thinking about ambulance. I never knew how I can get it. I got it. When I started, I dreamed about building a clinic. I never knew how I would get there. I got it. And even when we got the clinic, I never knew how we keep it. And somebody introduced me to another person who collected the equipment we put in a container and shipped to equip it. So don't just overthink, because the economists, people who did economy 101 will tell you, oh, how are you going to do this? How are you going to do that? Don't listen. If you believe in it, just keep going, keep pushing. This is what has carried me through. Every day. Like, did I know that I'll meet you, Iddi? In 2005, I never knew. Now you are working with me. I never knew I'll meet you, right? But God has planned this already. That you meet Iddi one day, he will be the one to take you to reach a different group of people that you are not reaching, So yeah, so that's the lesson that I've learned so far from this project.
That's right. Yeah. That's right, Professor. It's all about one step at a time, and indeed, you showing that in action, or just in word. Thank you so much, my dear viewers and listeners. This is the SUKI Podcast. My name is Iddi Mtumweni, here with Professor Blaise. He is a founder and the founder of Bawa Initiative, Health Initiative. Thank you for.
I would say co-founder. Co-founder. Thank you. My co-founder is Professor Dennis Richardson, who invested all his savings for us to start.
You had that right. Yeah, he's a co-founder of Bawa Health Initiative. Thank you for staying with us. Please share your thoughts in the comment and let us know what you think about the Bawa Health Initiative and the story behind it. Professor, let's shift a little bit from what you're doing and to to African diaspora in general. As African living abroad, how can we promote Pan-Africanism in the context of social and community development of African country? Like what are you doing now with the Bawa Health Initiative? It will be amazing to see, as African, we're doing the same kind of project across African country, like under the one project. What role can Africa diaspora play to improve the quality of life across a continent? Professor, you from West Africa, I'm from East Africa. We're all African and we're living abroad. It's a time to give back to the society, the African country. What are your thoughts on that?
So, Iddi, what I always tell myself, and I tell my brothers and sisters from Africa and any migrant, that you should consider yourself as an ambassador of your family, of your village, of your city, of your country, of your continent. And never, never, ever be ashamed of where you come from. Never, never be ashamed of where you come from. You might not have everything, but that's where God chose you to be born from. And He chose that place for you for a reason. He chose that place for you to be born there because He knew you are going to be part of what He wants to realize there. So then ask yourself the question, what can I do to make the life of the people that are left behind me better? You know, what can I do? Do they need water? And you don't have to do everything. Just do what you can. You don't have to do exactly what I'm doing. You can provide textbook. You can just raise money to buy supplies, school supplies at the beginning of each academic year. You know, we know that a pencil, there are some children in Africa who go to school, they don't even have a pencil. They don't have a notebook. It happened in my village when I was growing up. It must still be happening. You know, there's so much that we can do that doesn't take much. And Iddi, you agree with me that it's not that expensive to change people's life in Africa. $10, $10, $1, yes. You know, and if we are as African diaspora, as we think about that, we can make a difference. We don't have to do things that are big. They don't have to be big. If you can afford to do big things, fine. But if you cannot, go ahead and do what you can do. And believe me, one thing that I've done, Iddi, is to collect gently used tennis shoes in this town and ship to Cameroon. You know, as a child, I was walking without shoes. So if I now get a tennis gently used Nike shoes, or whatever shoes, to somebody, to a child in power, it will make a difference. It will bring them a smile. And you don't buy that smile. That smile is so expensive that you cannot put a price tag on it. You know? So there's so much that we can do. And to me, it's easy. Because if you even save $5, $1 a day or a month in your paycheck, you are going to go back to the place where maybe your former school where you grew up. Or if you didn't grow up in Africa and you were born in the US, where your parents grew up, where your dad went to school, your mom went to school, your uncle went to school, and so on and so forth, you can make a difference. And it's so easy. To me, it's so easy because it's not that expensive. Remember what we just said, right? That we were able to buy an ambulance for about $70 and ship it for about $70,000. Can you put a price tag on an organ transplant that is flown from maybe Seattle to Los Angeles? How much is that? Just one organ to say one person, right? And so it's $300,000. I don't even know how many thousands of dollars they put on that, right? But for us, $70,000 is what is saving people's life, and less than that, you know. So we have an opportunity to make a difference in the life of our people back home, provided that we think about them, provided that we are thinking about what we can do to make their life better. And there are so many opportunities, so many. So I personally will encourage us to, again, think of us as an ambassador. An ambassador is who? Who goes somewhere and bring back what is good there, right? We come to the US, wherever in Europe, Japan, wherever we are, and we find what is good, we take it home. We share with our people back home to make their life better. We didn't pass any special exam, any complete exam to be in the US. And the people who are back in Africa failed it. Did we pass an exam? No. Did they fail an exam? No. God just made it in such a way that we are here, they are there. And we are all, each one of us will be playing their role, right? We should be doing what we are doing. They should be doing what they are doing. And we are going to live like a community. We are going to live like children of God, And as I always say, the 5 fingers on our hand, each one of them plays a role. If one is not doing well, the whole hand is down. We should feel like that if I'm from Africa, I should play my role as an African. Because if I don't, I'm failing the person who created me. I'm failing myself, I'm failing my community. I have to play my own role. I have failed. I'm not saying that I always get it right. That's okay. I'm trying. Normally I should fail, right? I fail, but okay, I keep trying. I keep adjusting. Yeah. So yeah, that's what I was saying.
Thank you so much, Professor. And I'm sure our dear viewers and listeners, they're getting so much from you. That is a wisdom you're not getting every day in our life. We need somebody like you to remind us where we come from. And the little that we're making here, it's so much back home, and it can change life in every possible way. Thank you so much, Professor. That brings us to the end of this episode of SUKI Podcast today. It's been a pleasure having Professor Blaise with us, sharing valuable insight on the Bawa Initiative and the impacts of Pan-Africanism in the community development. A big thank to you, Professor Blaise, for taking the time to join us and share such inspirational thought.
Yes, thank you so much, Iddi. Thank you for having me. Thank you for doing what you are doing. And again, each one of us is doing his own job, right? You are the person who can take this and share with others. We are the people talking, right? So yeah, you are playing your role. I love that, right? We are all contributing to what we can do best,
We hope you found today's conversation both enlightening and motivating. Don't forget to share this episode with others who might benefit from it. Leave your thought and comment below in the comment section, and let us know what resonated with you the most. Stay tuned for more exciting episodes where we continue to bring you inspiring story and meaningful conversation. Until next time, thank you for listening and watching. My name is Iddi Mtumweni, and this is SUKI Podcast.